All right, well, why don't we go ahead and get started? So again, it's John Zweifler, and hopefully you're seeing my screen. If not, somebody yell at me. So Dr. Boris should be back in a couple of weeks, but today I wanted to update us on where we are with our COVID numbers, and then talk some about the availability of vaccine, additional doses and boosters, and then talk about air quality and the wildfires. So let's go ahead and dive in. So this is data from a couple days ago, so it hasn't changed dramatically. So close to 130,000 cases here in Fresno County, a really high number, over 10% of our population. Our case rate per 100,000 is now at 27.3. The graph at the bottom gives you a sense of what's been going on with COVID over since its inception. So you can see we had a surge back in July of 2020, and then the bigger surge over the winter. And then you can see where we're in the midst of another surge similar to what we had last summer, but we are finally starting to see some declines. We've also seen close to 2,000 deaths here in Fresno County, so a grim milestone for us. So as you're probably well aware, first we see the cases, then we see the hospitalizations, and then we see the deaths. So even though our cases are starting to taper off, we're continuing to, we're starting to see more deaths recently. This is information that's probably the most significant in terms of serious cases of COVID. So the top box indicates the number of positive patients that we have currently in our hospitals. So at the height of the pandemic, we had over 600 patients in our hospitals for COVID-related illnesses. And currently we're at 279. We were up to around 350, 400 a few weeks ago. So again, we're starting to come down a little bit. So that's an encouraging sign. You can see our 14-day rolling average was at 330. So going down to 280 again shows that we're on a decline. Similarly, in terms of ICU cases, rolling average was at 72. Now we're down to 57. So both of those are going in the right direction. On the left-hand side, you can also get a sense of where Fresno stands in relationship to other counties. Fresno is one of around the 5th largest county in the state. So in that sense, we're about where we should be. But if you look down this list, you can see that counties in Northern California, such as San Francisco, which is near the middle of this, is at 65, whereas we're at 279. So there's big differences in numbers, even with counties with similar numbers of similar populations. This is a summary of where we are in terms of what's been happening, and so our numbers have been gradually dropping. You can see that back in the summer, our positivity rate was around 1.5, so at the bottom of the left-hand table. At that time, our cases per 100,000 were at 2. And I think you may remember what it was like early in the summer, where it felt like we had actually gotten through this. And there was, at least like speaking for myself, a great sense of relief, as if we were finally through the pandemic. But then we've seen rapidly rising numbers up until we got above the 40s in terms of positivity, in terms of positive case rates per 100,000. To put that in perspective, when we had the blueprint and the various colored tiers, a purple tier was 14 and above. So we were well above the purple tier. We remain well above the purple tier. But finally, we are heading in the right direction. And we'll send out this information as well, and folks can take a closer look at this. But this is more current information. We can see that now our rate is down to cases per 100,000 is down to 28. And our positivity rate has dropped down to 7.8%, so down from 9.4. So pretty significant decrease just very recently. So again, it indicates that we're going in the right direction. One that we're concerned about here in Fresno County is our equity data. So this looks at compares how we're doing in the districts that are considered at highest risk based on the Healthy Places Index. That happens to be most of Fresno County. And in our equity districts, we're at our positivity rate is hovering around 9.9% as opposed to 7.8% in our other areas. So there's still a disparity there, a gap there, and one that we are working closely with community-based organizations and federally qualified health centers to try and close that gap. This slide gives you a comparison of Fresno County compared to other counties in the valley. The top line indicates what's going on in California, and you can see California as a whole is at 14.7, so still in the purple, but almost to the red. But then you look at our Central Valley counties, and you can see that San Joaquin Valley counties are in the 20s, 30s, 20s and 30s. So the valley is definitely lagging behind the rest of California. Fresno is kind of in the middle of the pack, but we're doing better than most of the other counties in the Central Valley. And then this graph, the orange line is Fresno, and this is cases per 100,000. And the blue line is California, and let's see if I can get rid of this. Yeah, so and the blue line is California, and so we can see that that Fresno County numbers were tracking statewide, but then in this most recent surge, we have exceeded what's going on in the rest of California. We plateaued there for a few weeks in September, but we're finally starting to see a downward trend. It would be nice to catch up with the rest of the state, and certainly the trends look like we're heading in that direction. Turning now to vaccination. So how do we make sure that we get through this surge and don't have another surge? You know, vaccines are our most potent weapon. And so you can see how many folks have been vaccinated. The graph on the right is from December of 2020 until September 2021. So you can see that vaccines really started to ramp up in February and March when they were released, and that we've had some plateauing since then. So as we've run into vaccine resistance from various quarters. When you look at the total number of our total population in Fresno County, we've got about 54, almost 55% of residents who have gotten at least one dose. So that corresponds with, Fresno County has a population of about 1 million, so it's actually fairly easy to calculate some of our rates. But we have about 55% of our population with at least one vaccine, so that includes all ages. And so that consists of about 480,000 fully vaccinated individuals, about 90,000 who are partially vaccinated. When you look just at those who are eligible to get the vaccine, which are those 12 and over, where our numbers look better. So we have that's because there's a smaller denominator, and here we're close to 2/3 of the population has had at least one vaccine. If you look at the population of 12 and over, in terms of this last week, we see about a 0.8% increase. So not a huge increase. The availability of boosters, which we'll talk about, is contributing to some of the increase. The brightest spot in terms of vaccines are, when you look at that, our elderly population. So if you look at those 65 and over who have received at least one vaccine, we're at close to 90%. So that's a really heartening number. I think that's one of this statistic is one of the main reasons why we're not seeing as many deaths as we did see earlier in the pandemic. When I speak to groups, I like to point this out for those who are vaccine hesitant. You look at who are our most vulnerable populations, and the ones who maybe should be most concerned about side effects, et cetera. Close to 90% have been vaccinated and extremely effective in terms of reducing hospitalizations and deaths in this population. When we look at the other end of the spectrum, so we look at our younger population, ages 12 to 17, about close to 46% have received at least one of the vaccines. When you break that down, our teenagers, 14 to 17, about 56%, the kids 12 to 13 at 38%. And so probably most of you heard or saw that Governor Newsom has declared that for school that vaccines, once they are fully approved, right now they have the emergency use authorization. Once they receive full approval, then they will be required the following semester. So theoretically, if the Pfizer, Moderna, Pfizer receives full approval prior to January, then theoretically kids ages 12 to 17 would be expected to be vaccinated when they go to school. Now, whether that age group will receive full approval by then, I think is unlikely. So I think we're probably looking at vaccine mandates for school-age kids for the summer and fall. But more to come on that. So that's a overview of where we are in terms of the pandemic currently. I did want to switch now to talk about vaccine, both the additional doses and the boosters, and to try and sort out the difference between the two. The CDC found has been monitoring the efficacy of the vaccines, and it's a little bit of a nuanced message. On the one hand, we're showing that the vaccine is still effective against COVID as well as the variants, but maybe not as effective when you look over time. There was some recent data that was released about Pfizer, and they were suggesting that whereas protection against infection initially was closer to 90%, after 6 months it decreased to around 50%, which seems rather dramatic. On the other hand, though, when you look at hospitalizations and deaths, you still see there's over 90% protection from the standard 2-dose regimen. So you're seeing some reduced efficacy in terms of preventing infection, but still very effective in terms of preventing hospitalizations and deaths. So based on that information, the CDC and the FDA have approved boosters, the booster for Pfizer for certain high-risk individuals. So prior to that move, the CDC and FDA had already approved an additional dose of COVID for those individuals with weakened immune systems. So immunocompromised individuals. And so immunocompromised are a pretty small population. So it's about 3% of adults. It would be folks who are under active cancer treatment, who are organ transplant recipients and receiving immunosuppressant medications. If you have active or end-stage HIV, or if you're on high-dose steroids would be the other category. So it's not a really broad group that's defined as having moderate to severe immunocompromise. So it's really folks in those age groups. I saw a study in JAMA that showed that if you looked at individuals with kidney transplants after getting 2 doses of the vaccine, that only about 50% of them had generated any immunity. So the recommendation is that whether you received Pfizer or Moderna, and you're in that immunocompromised group, that you get an additional 3rd dose of the COVID mRNA vaccine. And this vaccine could be administered anytime after 28 days after your 2nd dose. But then just this last week, the CDC and FDA authorized a booster dose for another group of individuals. So these are for high-risk individuals, and so in this group, it's the expectation is that the first 2 doses were effective, but that we're going to boost that efficacy. And so currently, this is only available, has only been approved for those who have received the Pfizer vaccine. And so not only Pfizer, but it has to have been at least 6 months since the last dose. So who are those who should be receiving the booster dose? Well, those who are 65 and older, or if they're in a long-term care facility, or individuals who are 50 to 64 with underlying medical conditions. But they also added this other group, or if you're at increased risk of social inequities. So here in Fresno County, where most of Fresno County lies within a tier 1 of the Healthy People's Index, the majority of 50 to 64-year-olds, and actually, I think it's all age group. If anyone 12 and over, if you're in at increased risk of social inequities, you're eligible to get that booster dose. They also added another group of individuals, and these are individuals who, because of their work or occupation or where they're living, who would be at increased risk of COVID. So again, a broad swath of the population falls into this category. So first responders, teachers, food and ag workers, grocery store, healthcare workers, of course. So pretty much anyone who who got the Pfizer would be able to would theoretically be eligible for the booster in one of these categories. If you got either the Moderna or the J&J, there's currently not a booster that's authorized, but both Moderna and J&J are in the pipeline and looking at this. And so, can someone with who received Moderna or J&J get the Pfizer vaccine? Well, in the United States, currently that's not recommended, so we don't offer that. So I'm going to switch gears once more and talk about wildfires. So I'm actually, as I'm speaking to you, I happen to be in Michigan, where it's about 65 degrees and it's been off and on rainy, and the trees are changing color. So I sympathize with all of my brethren in the Central Valley. But this is an image of the San Joaquin Valley because of the KNP and the complex and the windy fires currently. So not a pretty picture. So how do we interpret this for our patients? How do we discuss air quality? Well, it's interesting when you dig into this. So there's actually in terms of what activities can you do when the air quality is bad, there are no state laws or rules about when activities have to be canceled or moved indoors. There are some Cal OSHA standards that address this, but for the rest of us, as far as what we do in our free time, and if our jobs don't require us to be outdoors, there's no particular restrictions on what we can or cannot do. in our schools do have the ability, our school districts do have the ability to decide when activities need to be moved indoors or when to cancel physical education or sports events. And so those, so each school district makes those decisions on its own. Just to give you some sense of, what are the most severe risks? According to Cal OSHA, if the air quality index is over 150 and someone has to work outdoors, then an employer is required to provide their workers with an N95 mask if they have to work outside for more than an hour. So we can get information about air quality in a number of ways, just from our phones. If you look at our weather reports, but we also have the San Joaquin Valley Air Pollution Control District in our area, and they provide excellent updates on air quality through what's called their real-time air advisory network. And you can sign up for that, and you can give them your zip code, and you can get very specific information from them. Here in the Central Valley, our Central Valley schools also work to develop what they call the real-time outdoor activity risk guideline. So this was developed has been in place for about 10 years, developed in cooperation with UCSF Fresno and the American Lung Association. And so it also provides great information and guidance. Those acronyms get a little bit confusing. This was something that I downloaded from the San Joaquin Valley Air Quality Board site, comparing the activity report to the AQI. So there's slightly, whereas ROAR has 5 levels, the AQI usually uses 6 levels. The color coding gets a little confusing as well, but I think the important thing is to remember, once you're getting air quality indexes above 100 and certainly above 150, which is where the air quality has been in Fresno, then you're in a dangerous area. In terms of the different air quality levels that the schools look at, they again use a yellow, red, purple, dark red color scheme, but it gets very confusing when you compare that to what's going on in the when you compare that to the AQI, which has a different kind of color scale. But again, in general, if you've got air quality index above 100 to 150, you're looking at limiting physical education and activities, and certainly and then canceling sporting events if their air quality index is above 100 to 150. So that's the information I had for today, and I apologize for not being Dr. Vora, but I'd be happy to answer any questions, and any that I cannot respond to, I'll pass those on to Dr. Vora. If anyone has any questions or comments that they would like to ask or bring forward. All right, well, hearing none, we'll plan to do this again next week, and hopefully we'll have Dr. Vora back in a couple of weeks as well. And in the meantime, stay safe. If you are outside and the air quality is above 100, 150, use one of your N95s. So everyone stay safe. Encourage all of your patients to get vaccinated. Thanks, everyone.
Thank you.